Let's demonstrate how to use an AED on an adult. Open and turn on the AED. Follow the prompts.
Adult patient.
So the first thing it's going to ask you to do is place the pad on the person's bare chest. So remove the clothes.
Remove clothing from the patient's chest.
Remove any jewelry, medicine pouches, water sweats. Wipe that off. And any excessive hair, you want to shave where you're actually putting the pads. Okay, and very good. Grab the pads. Have a look at the pads. Match the picture with the person and place the pad in the appropriate spot. So one pad goes on the upper right side of the chest, and the other pad is going to go on the lower left side. Load the chest muscle so that you have a diagonal process that the electrical current can go through.
Once the pads are placed, the AED will analyze for a shockable heart rhythm.
Do not touch the patient. Analyzing heart rhythm.
If the AED determines a shockable rhythm, it will say,
Shock advised.
"Shock advised," and will start charging.
Do not touch the patient. Everyone clear.
When the AED is fully charged, the flashing light will occur. Before pushing the flashing light, be sure to say,
"I'm clear, you're clear, we're all clear. Shocking now."
Now. Shock delivered.
Once the shock is delivered, check for signs of life, spontaneous coughing, breathing, or movement. If there is no signs of life, continue CPR, 30 compressions, and 2 breaths until EMS arrive. The AED will reanalyze every 2 minutes. It will tell you to stop compressions while it analyzes for heart rhythm. It may say shock advised or no shock advised. Follow the prompts of the AED.